Hi, I'm Dr. Cynthia Matossian. In this video, we're going to talk about the do's and don'ts after eye surgery, including the recommended limitations in your activities. We will also describe the rare early warning signs of trouble that, if you happen to experience, you should report to us right away. Because there's a lot of information here, you may want to watch this video more than once. To protect your eye after you've had surgery, you may have a patch or a clear plastic cover over your eye depending on the procedure. In some cases, we'll ask you to leave the patch on until the morning after your eye surgery, and in other cases, we'll ask you to tape the clear shield over your operated eye at bedtime.
Please refer to your instruction sheet. Typically, we ask you to tape the plastic shield over your operated eye at bedtime for 7 days. That way, you don't accidentally rub your eye or harm it while you're sleeping. You can use normal medical tape to secure the shield over the eye. The goal is to have a solid barrier to protect your eye from being rubbed or bumped while asleep. This shield can be washed with soap and warm water. After most eye surgeries, you'll need to use eye drops. Sometimes you may need to take medications by mouth to help your eye heal. You will be given an instruction sheet telling you exactly what to take and when. Take time to learn the names of the drops, the color of the bottle caps, and how often you're supposed to use each medication. Some of the drops may need to be used for several weeks, while others are used for a much shorter period of time. If you normally take eye drops for glaucoma, please continue to use them after your eye surgery, just as before, unless we tell you otherwise.
If you use artificial tears or lubricating eye drops, please hold off on using them for a few weeks as they may wash away the prescription medications. Please wait 5 to 10 minutes between different eye drops. That allows the first drop to get absorbed into the eye instead of being washed away by the second medication. Please refer to our separate video on how to effectively use eye drops. For the first 1 or 2 days after surgery, you may feel groggy, tired, a little nauseated, dizzy, or have other symptoms of feeling unwell. These are common side effects that linger after the surgery because of medications used to relax you during surgery. Because of these symptoms, we recommend that you not drive until morning after surgery.
Fortunately, serious pain is quite uncommon after eye surgery. Many people have little discomfort or a scratchy feeling like having an eyelash in their eye for the first 24 hours after surgery. Usually Tylenol, Advil, Aleve, or aspirin are adequate to take care of the slight discomfort you may feel. If you experience some discomfort, please feel free to take any pain reliever that normally works for you. If you experience severe pain, please call us at the phone number listed on your instruction sheet right away.
It's okay to be left alone for the rest of the day after surgery, as long as you can follow the instructions given to you on your own. We recommend that you take it easy for the rest of the day. It's okay to watch TV, to read, or to work on a computer. It's also okay to resume your normal diet as your appetite allows. The day after your eye surgery, you can resume most normal activities, but there are a few limitations we recommend. It's okay to shower, but it's best to turn your back against the shower spray to avoid anything getting into your eye. It's okay to walk for exercise, use a stationary bike non-strenuously, use a computer, read, go to work, cook, and do light housework, as long as you're not lifting anything heavy or straining yourself. You can drive a car the morning after surgery if you feel well enough to do so safely.
With the exception of some retina surgeries where gas is placed inside the eye, it's generally okay to fly in a plane and do most activities that feel comfortable after surgery. If you're unsure, please err on the side of caution, and of course you can always ask our staff. Activities we ask you to avoid for the first 2 weeks include any heavy lifting of 25 pounds or more, Vigorous sports like tennis, golf, running, or active biking. Avoid all makeup for about 2 weeks after surgery. Thereafter, you can use eyeshadow, concealer, eyeliner, as long as they are new and not old and possibly contaminated. Please avoid using mascara for 4 weeks since a rubbing action is required for its removal. We also recommend that you avoid swimming in a pool, in the ocean, or go in a hot tub for about 4 weeks after your eye surgery.
Since your eye may be a little light sensitive, we provide you with a pair of sunglasses to wear if you wish. It's not mandatory for you to wear sunglasses after surgery any more than you normally do, but you may feel more comfortable with sunglasses when you go outside. What's most important is that you not rub your eye. With most surgeries, the eye will look fairly normal, but there may be some bright redness on the eyeball. It usually takes 2, 3, or 4 weeks for this to gradually fade away. This is especially common for people who use aspirin, blood thinners, or who have a tendency to bruise easily.
Bruising of the eyelids is fairly common after eyelid surgery. That's because even the smallest amount of bleeding from the tiny vessels around the eye can be quite noticeable. Please be patient, and this bruising will fade away in just over a few weeks. I hope this information is helpful, and I encourage you to ask our staff if you have any additional questions about your surgery. I'm Dr. Priya Desai.
I'm Dr. Sebastian Lesniak.
I'm Dr. Cynthia Matossian. Thank you for watching.